So I came to Leicester as a student 10 years ago. I still haven't left. I've thought about it a couple of times, but I'm still here, and I really enjoy the challenges of working in healthcare in Leicester. It's a fantastic environment. I do a couple of things at the moment. I teach. I also have an interest in clinical leadership and research, and have done some parts in that area, so I do quite a lot of diverse things. And my what I'm trying to do tonight is to give you a bit of a background to this really quite unbelievable war that seems to have erupted between the medical profession and the government, and it's not something that I really ever envisaged happening. But the target of a lot of this ire has been these things called junior doctors. So I find this incredible that NHS employers doesn't seem to know what a junior doctor is. In fact, the Secretary of State team seems entirely ignorant of this concept. So does anybody in here know what a junior doctor is? Go on, have a go.
Well, is it a doctor who's passed their medical degree and is doing their training in a hospital before they go on to specialise?
Halfway there. It's effectively any doctor who is not yet a consultant or a GP. So from when I graduated medical school at the age of 25, actually a little bit longer than some people, I started as a junior doctor. I will be a junior doctor well into my 30s. Some of my colleagues will make it into their 40s as junior doctors. This is not a bunch of teenagers just out of med school. Okay, and I kind of want to make that clear. So just to give you a little bit of background, our current contract that we work under was agreed in the 90s and had this aim of trying to reduce us doing 150-hour weeks where you fell asleep on the patient while you examined them. And what it came up with this idea was that we'd pay people a salary, and then we would pay them a fairly significant proportion of that salary additionally to cover working outside normal hours, which was 7 till 7, Monday to Friday. So when you worked outside of those hours, for a proportion of it, you got a certain amount of extra pay. And this was really effective at controlling excess hours at the time. And about 3 years ago, there was an agreement that actually a lot of elements of the contract were getting outdated, and we're trying to renegotiate it. And negotiations broke down and were sent to the Independent Doctors and Dentists Pay Review Body. It's a really interesting organisation. How many doctors and dentists do you think sit on it?
0.
No. However, it has got a professor of geography, so it's really representative of our profession. And then all of a sudden this narrative changed, and it came around this idea of 7-day working, which was a real surprise to those of us who already do 7-day working. And the Secretary of State suddenly started this idea of lots of people dying because I don't work at the weekend. And we started off with 6,000 excess deaths, and now we're at 11, and then there's a series of independent studies, but they can't tell me what all the excess studies are. And there's a huge debate about the methods used in them and how much influence the Secretary of State might have had on how they got into publication. And the editor of the British Medical Journal has publicly rebuked him in an editorial for mishandling data. But because I have a real passion for what we call evidence-based medicine, which is looking at the published data rather than what some famous professor says, I can try and give you an example. One of the studies that he trotted out was about stroke deaths at the weekend. Now, when you have a stroke, you tend to go into hospital. If you have a very minor stroke, minor symptoms, on the weekend, you probably don't see anybody till Monday morning, so you go in on Monday. If you have a minor stroke, you're not very likely to die. If you have a big stroke, which means that you definitely have to go to hospital right away, your chance of dying is much greater. So if you have a big stroke on a weekend or a weekday, you'll go into hospital. But on the weekend, the smaller strokes don't tend to make it. So the death rate of patients who come in just as a crude rate on a weekend and a weekday is different. Does that idea make sense to everybody, roughly? Good, you now know more evidence-based medicine than the Secretary of State for Health. He can't grasp this argument. I don't think it's difficult. But all this kind of thing came as this really bizarre idea about 7-day working, when currently we do not have enough medical or other staff to staff a 5-day rota. So when doctors finish the first 2 years of their training, when they've come out of university, they apply to work to go into something with specialty training. This year is the first time less than half of those have applied to continue their training in the NHS. 7 years ago it was 86%, this year it's less than half. So we are hemorrhaging staff, literally. We cannot recruit. GPs in Leicestershire and the East Midlands cannot recruit. You wonder why you've got a big wait to see your GP? They haven't got any left. They've had enough. They've had enough of the stress, the pressure to go in, and they can't recruit people coming through. Do you, out of interest, do you know how much your GP is paid to look after you a year? £136. So actually the health insurance that I pay for my 2 pet rabbits is bigger than the your GP is paid to look after you every year. Think about that in terms of healthcare economics. And actually, for anyone who saw, there's an article yesterday about taking people who don't visit regularly enough off their GP's list. The ones who don't come in, their money funds the ones who come a bit more often. Again, apparently this argument doesn't get there. But anyway, we now have this situation where we're told that we're all getting a pay rise, we're going to work fewer hours, and we're going to all work more across the weekends, but without having to do any extra work in much safer conditions. Now, I'm no maths expert, but this doesn't add up. You cannot take something that won't cover 5 days, make it cover 7 days, and be better. It's simple maths. We're told that we're not getting a pay cut, but it's okay, because if we do get a pay cut, we'll have pay protection for 3 years. So you'll be all right, just be prepared to screw the next generation. I'm not prepared to do that, frankly, and a lot of my colleagues aren't. There are a few other bizarre clauses in this contract. So how are they going to stop me working excess hours? How are they going to stop me working hours that are dangerous when I already have enough difficulty in actually getting into my car at the end of the night shift and not crashing on the 3-mile journey home? Well, we're going to have a guardian where if they find out I'm consistently working too much, the hospital can fine itself. And that sounds really sensible to me, because of course it would be much cheaper to work me into the ground and fine itself, and then just use that fine to pay for something else, wouldn't it? The other thing that they've introduced is the idea of a first refusal clause. So for those who go and do agency work in another hospital, they'll now have to offer that time to their original employer at a much lower rate first. And that sounds quite a sensible idea. Has anybody ever walked through Nelson Mandela Park and heard that whoomph noise as that little yellow helicopter comes down? Do you know what it is? Anybody? You seen it? Yeah, it's the air ambulance. Do you know what happens when you get a doctor on the air ambulance? It's a junior doctor. It's not a senior, it's a junior. There might be somebody very experienced. Guys may well not actually be able to work for the ambulance service now and gain additional experience in dealing with very sick people pre-hospital. I've got a number of friends who spend their weekends running around in red jumpsuits. I think they have an adrenaline junkie problem, but they love doing that and they give a huge amount back to their community. And that may well be gone now. I'm going to not go into too much more detail because I don't want to bore you all with it, but there's this idea that I've been misled. I don't understand this clearly. Well, I've been trained to assess evidence. Actually, I teach doctors how to assess evidence. I haven't been misled. I haven't got some horrible militant, and just think how inappropriate that phrase is right now. I've not got some horrible militant union pushing me into things. I know what I'm doing. And I'm fundamentally opposed to this contract as being unsafe and unfair. So what have we done? You've probably seen us. We sit in the town centre and we talk to people. We delivered a petition of 50,000 against this proposal. By the way, people of Leicester, you contributed 7,000. Thank you very much. You were bigger than anywhere in the country. That wasn't much of a surprise to those of us who work here. But essentially, I quote the president of the Royal College of Obstetrics and Gynecology. Now, there's somebody who knows about safe care of mothers and babies. These are essentially cost-cutting measures dressed up to present a front of patient safety. It isn't about working Saturdays, but we already do. We'll still keep doing them. But you cannot push this service any further. It's already broken. It's not breaking, it's gone. And there's one final thing I'm going to mention in this, and this is something that's really gone under the radar. Leicester, we have a proud tradition of training not only doctors, but nurses, physiotherapists, pharmacists. We actually help with the training of podiatrists, huge number of healthcare professionals. particularly the nurses, are supported by a bursary because they work effectively full-time for the NHS while they gain their skills. And they have a bursary to do that, which doesn't pay them, it just about keeps them alive, and it's a struggle. So the government's solution to the fact that we don't have any nurses, and we've now kind of scraped pretty much all that we can out of the Philippines, and we've kind of pulled as much as we can out of Spain and Portugal now, is that we're going to abolish the student nurses bursary, and we'll just give them a £50,000 debt by the time they go out of here. How appalling is that as a concept? So it's just the one thing I really want to get across. If you want to make us think about something, make us think about that, because next time you're unfortunate enough to end up in hospital, the student nurse who cares for you is potentially paying 50 grand for the privilege. At that point, I'm going to leave it there, but if people want to talk to me about this issue, they've got my contact details. I'm more than happy to speak to people and tell you how you can support us.